But in the meantime, I've been eager to talk on the floor today about an ongoing issue in all of our communities around the country, sadly, which is this issue of prescription drug and heroin and now fentanyl. It's really an epidemic, and it's now the #1 cause of accidental death in my home state of Ohio, and I'm told recently it's the #1 cause of accidental death in our country, surpassing car accidents. It's something that's taking thousands of lives every year, and it's something that is tearing families apart, causing crime, creating real hardship for so many families, hurting our economy. This week, President Obama and his administration declared Heroin Epidemic Awareness Week, and I commend them for that. I think raising the awareness of this issue is really important right now. Having a national conversation on this issue is really important right now. This is the opportunity I take every week to come to the floor. I've been doing it since before we passed the Comprehensive Addiction Recovery Act, which was back in March. And I come every week on the floor to talk about the importance of addressing the issue, initially getting the legislation passed. Once we did that, now implementing that legislation, and even adding some additional legislation because of this new wave of addictions that we're seeing and overdose and deaths based on synthetic heroin, also called fentanyl or carfentanil or U4, that's coming into our communities. About once a month, Mr. President, I have a teletown hall, and I ask people on the call a number of questions, and they answer about their top priorities. And I've started asking a question, which is, how many of you have been directly affected by the heroin and prescription drug epidemic in Ohio? And I would tell you, sadly, in the last few calls, we've had some pretty surprising results, which is that roughly half the people on the call say that they have been affected. Whether I'm calling people in Cleveland or Columbus or rural areas, no matter where it is. I recently called people in Canton, Ohio, and Wood County outside of Toledo. 49% of the people on the call said yes, they had been affected directly. Early this month, I talked to people in my hometown of Cincinnati. It was 51%. Here's something even more alarming. A couple months ago, I called people in Southeast Ohio. Some of you know Portsmouth, Ohio, is an area that unfortunately has been hit particularly hard. In fact, there's a book that some may have read, and if you have not, you're interested in this issue, I would recommend it. It's called Dreamland. It's by a guy named Sam Quinones. And what the author talks about is the history behind this prescription drug, heroin, opioid epidemic, and some suggestions, therefore, as to how to address it. In any case, I called Southeast Ohio. Dreamland is based on a community center and a swimming pool. That's a name of a swimming pool in Portsmouth, Ohio. 68% of the people, 68% of the people on the call said they were directly affected. Typically, we have about 25,000 people on these calls, and 68% said they were directly affected. That's alarming. But it doesn't surprise me because I see it when I'm home, and so many other people are seeing it now, too. Some of you know recently there was something that went viral on Facebook. It was a photograph of two people passed out in front of a car and a child in the back seat. And it happened in Northeast Ohio, East Liverpool, Ohio. This has been shared now thousands and thousands of times and commented thousands and thousands of times. The two people in the front seat were the grandmother and her boyfriend, and the grandson was in the back seat, age 4. They were passed out, overdosed in the front seat. He was looking confused and alarmed in the back seat. This, unfortunately, is something that is happening around our country. The East Liverpool police said at the time, "It is time that the non-drug using public sees what we are dealing with on a daily basis. The poison known as heroin has taken a strong grip on many communities, not just ours." That was the police in East Liverpool. I agree with them, because they see these images every day, not just in East Liverpool, but in your hometown, in your county. This is not the only child who has watched his parents overdose. In Cleveland, 2 weeks ago, a 6-year-old boy was found in Barkwell Park shaking and crying next to his parents, both of whom were unconscious. Heroin overdoses. Another incident that's received national attention is the spike of overdoses. We had 24 in Akron, Ohio, 1 week ago today. 24 on one day, 1 week ago today. So far, 112 people in Akron, by the way, have died from overdoses this year. Of course, that's already a record. Already this year, more people have died in Akron than all of last year. This spike in overdoses in Akron follows an even larger spike in my hometown of Cincinnati, Ohio, where since August 19th, there have been nearly 300 heroin overdoses. During one 6-day period, 174 of them. I went to the firehouse that responded to most of the largest number of those overdoses and talked to the firefighters there about it, and they talked about administering Narcan This is this miracle drug that actually can reverse the overdose. Typically, it's administered once. With regard to these overdoses, and they saved so many lives, 34 lives in this case, these overdoses had to use Narcan not once, not twice, not 3 times, but 4 or 5 times. Because we found out later, and I was able to help get samples to Cincinnati to find this out, there was carfentanil mixed with the heroin. This, again, is a synthetic drug that traffickers are now using that is far more powerful even than heroin. Carfentanil actually is something that is used as a sedative for large animals, for elephants. And yet traffickers are using this along with heroin. The Hamilton County coroner, Lakshmi Samarko, has confirmed that at least 8 of the overdoses during that unprecedented 6-day period in Cincinnati were directly a result of carfentanil. Some of these victims, again, were not able to be brought back to life. Some of them did pass away. But these brave first responders responded quickly, professionally, were able to save all but 4 or 5 lives out of 174 in a 6-day period. Incredible. This new thing called fentanyl is incredibly powerful. It is something that if only a few flakes of it are ingested by a human being, it can kill you. If you want an idea of how addictive this stuff is, consider the story of the woman in Massillon, Ohio, who last Saturday used heroin with her boyfriend. He died of an overdose right next to her. And according to police, after he died, she left his corpse lying there for 11 hours because she wanted to go out and get more heroin. I've met with addicts who are still using. I've met with those in recovery all over Ohio. I've met with several hundred people who have a story to tell. I'm told again and again by those who are in recovery the same thing, which is, Rob, the drug becomes everything. The drug becomes more important than family, more important than work, more important than not doing what many of these people have never done before, which is commit crimes in order to pay for their habit. As addictive as heroin is, this fentanyl can be 50, even 100 times as powerful. According to the DEA, Drug Enforcement Agency, carfentanil can be many times more powerful, up to 10 times as powerful as morphine. Again, it's used primarily to take down elephants and used as a sedative. As one person said, the police officer in Newtown, Ohio, who heads up our Hamilton County heroin drug task force, quote, "The side effect of carfentanil is death." These synthetic drugs are contributing in Ohio to our rapid increase in overdoses. Since 2000, the number of annual opioid overdoses in Ohio has increased dramatically. We're now losing 1 life to overdoses every 3 hours. And we happen to have information now coming in on fentanyl. Just in the last 2 years, we have records for it, which would be from 2013 to 2015. We saw a 13-fold increase in fentanyl-related deaths, 13-fold increase. Just 3 years ago, about 1 in 20 drug overdoses in Ohio was a result of fentanyl. Now it's more than 1 in 3. Sadly, I expect that number to rise substantially this year based on the information we have. So the message today, first of all, to those who might be listening or a family member who might be listening, if you're suffering from this addiction, get treatment. Find some place that provides treatment and longer-term recovery. This legislation, the Comprehensive Addiction Recovery Act that passed this House with a vote of 92-2, will help to provide more of that treatment and recovery, the first time we've ever dealt with recovery here in the United States Congress. It's very important. If you don't know whether the heroin that's on the street contains these deadly synthetic drugs, you need to be extremely, extremely careful. As Coroner Samarko in Hamilton County puts it, every time you buy heroin or every time you inject it, you may be literally gambling with your life. These synthetic drugs are devastating Ohio, but they don't come from Ohio. They don't come primarily from any of our states. We're told by the experts and law enforcement they come from overseas, primarily from China. So there are laboratories in China who are developing this poison, this fentanyl and carfentanil. Some of the labs, we're told, also are in India. Coming from China and India, it then comes through the U.S. mail. It comes through their postal system and our postal system into the United States. Unbelievable. The poison is coming in the mail to our communities. It's easy to do because, unlike private carriers, think UPS or FedEx, in the mail system, you can send a package without having any information attached to it. It shouldn't be that easy, and it doesn't have to be. We want to close this loophole. It's a common sense idea that will help to keep our streets safer and to help prevent some of these deadly overdoses from these synthetic heroines. Customs and Border Protection has told us that if we had advanced electronic data on these packages coming from overseas, as you must have, again, if you're a private carrier like UPS or FedEx, it would help to ensure these dangerous drugs don't end up in the hands of drug traffickers, or worse yet, in the hands of our neighbors, our friends, some of our family members. We've introduced legislation called the Synthetics Trafficking and Overdose Prevention Act, or the STOP Act, and it's very simple. It's to try to help keep this poison off our streets by simply closing the loophole and requiring that same advanced electronic data to come with all these packages coming from overseas. Where it's coming from, what's in it, and where it's going. Traffickers are using the mail system because they don't have to provide that now if they send it through the mail system. I think this legislation goes hand in hand with the Comprehensive Addiction and Recovery Act we talked about earlier, CARA, which again, both houses passed with near unanimous votes. The President signed in July. This legislation, CARA, is a tremendous step forward. It's very comprehensive. Prevention, education, treatment, and recovery. It helps with providing law enforcement officers with the Narcan that they need. Helps with regard to getting these prescription drugs off the shelves with drug take-back programs. It's a good bill. But I think this is complementary to it to be able to now help to stop this new surge we're getting of this fentanyl and carfentanil. I urge the administration, especially in light of these tragic events recently and during this prescription opioid and heroin epidemic awareness week, to implement the legislation CARA as soon as possible, because there are a number of new programs under CARA that must be implemented for our veterans, for pregnant women, for babies born with dependency, to ensure that we're getting the drug courts up and going and getting the funding that they need. The President and his administration, if they get these grant programs up and running, will be able to make a bigger difference sooner. And let's also increase the funding for opioid programs. We have a 47% increase in the funding this year, the fiscal year we're in right now. But of course, we're coming to the end of that fiscal year. CARA has another $181 million per year in authorized funding per year going forward for this opioid issue, heroin, prescription drugs, fentanyl. We should make a down payment toward that in this continuing resolution. I know it's only a short-term continuing resolution we're talking about on the floor here today in order to keep the funding going, but even there, we need to make a down payment to ensure that CARA is fully funded. And if you're one of the 92 senators who supported the Comprehensive Addiction Recovery Act, I hope you'll look at the STOP Act. It's entirely complementary to CARA. It will help to deal with a very real problem, limiting the supply of these dangerous drugs right now. It's a bipartisan bill. Last week, Pat Tiberi and Richard Neal introduced the STOP Act in the House. So we have a companion bill in the House that is bipartisan. They've both got a real passion for this issue. I appreciate them. Everything that we're doing in this area is important right now, and every senator should be involved. If you're tough on crime, you should care about the increase in crime that's being created by this. If you're concerned about the innocent victims of an addiction epidemic, you should support this legislation to help protect these children who are being born with addictions. If you want to be tougher on China or you want better border security, you should support this legislation to try to shut off this poison coming in to our states from other countries. If you care about
Senator has used 10 minutes.
You should care. Unanimous consent for one additional moment.
Without objection.
Mr. President, again, this is an issue that has brought us all together in the past. Let's continue to work together on this on a bipartisan basis to begin to turn the tide on this epidemic before it's too late, before we lose more of our young people, before we have more communities devastated by this crisis. I thank you for